Hello, and welcome to today's session. My name is Sue Lang with the Department of Health Drinking Water Protection Section. I'm joined by colleagues who will share information about the model plan for lead testing in drinking water in early care and education settings. At this time, I'd like to introduce our first presenter. Blake Maddie is lead in drinking water specialist who will discuss the background and health effects of lead. Here now is Blake.
Thanks, Sue. Hi, I'm Blake Maddie, and I'm a lead and drinking water specialist with MDH. I work with facilities during our results reporting process to upload their lead testing and reporting data. I'm going to start off our presentation with some background on the health effects of lead. Lead is a toxic metal, and it's harmful to human health if ingested or inhaled. And there are three key things to remember about lead during this presentation. The first is that children are most at risk. Children are more susceptible to the effects of lead because their bodies absorb metals at higher rates than the average adult, and children 6 and under are most at risk due to their rapid growth rate and brain development. The second is that no level of lead is safe. Any blood lead level can have negative health effects, and water is just one potential source. Others might include paint, dust, or soil. While water is typically not the most prominent source of lead for an individual, reducing it in early care and education settings can reduce overall exposure, which is our goal when we know that no level is safe. Finally, lead impacts learning and behavior. Lead has been shown to reduce attention spans, increase hyperactivity, and cause poor classroom performance. Anyone can be affected by lead, but children and pregnant people are most vulnerable to its effects. Lead can have numerous health impacts, some of which are shown on the right. But despite the variety of health effects, many individuals with elevated blood lead levels have no apparent signs or symptoms. Now I'd like to discuss where lead could be found in your facility. The diagram on the right shows potential sources of lead in a school, and the key takeaway here is lead may be present in various materials in a building's plumbing system. Some possible sources might include lead solder, brass parts, galvanized steel, or lead service lines. And corrosion of these materials allows lead to dissolve into the water as it passes through the system. And as lead moves through that system, areas where it can build up are called sink locations. Some examples might be faucet aerators, water cooler strainers, or Y valves. And this buildup of lead can lead to higher levels when testing or consuming the water. Now I'll briefly review some new requirements based on the SF 2995 amendment. These requirements affect child care centers and schools differently. So starting with child care centers, they must by July 1st, 2024, have a plan and begin testing all taps used for consumption at least once every 5 years. Remediate if lead is found at 5 parts per billion or higher. Make results available to parents within 30 days of receiving them, and report results to the Minnesota Department of Health. And I'll discuss the reporting process for both child care centers and schools later in the presentation. For schools, they must update their plans to include a water management plan to maintain water quality. They must remediate when lead is 5 parts per billion or more, and they must report their results to MDH beginning July 1st, 2024. Schools will also need to post their results online. Now that we've discussed some background information, I'm going to hand it off to Caroline to learn more about the model plan.
Thanks, Blake. Hi, my name is Caroline Olstad, and I'm a lead and drinking water specialist at the Minnesota Department of Health. MDH created a technical guidance document, which is a one-stop place for all the information that pertains to schools and child care centers in Minnesota for lead and drinking water testing. That document includes more about those requirements and then also has a model plan that can be used for creating the lead and drinking water program for your facility. MDH has a model plan specific web page, which we've included that link for here on this slide. And that webpage contains a short overview of each step of the model plan, which we'll also talk about each one of those steps on this webinar today. And then the webpage has the link to the full 43-page technical guidance document. So that would be a good one to save in case you ever needed to refer back to. It has a lot of the answers to many of the questions that you may be wondering about. So step 1 of the model plan is sampling program development. Early care and education settings, or ECEs, must make a lead in drinking water plan that addresses the core concepts of testing, remediating, reporting, and communicating results. You can make your own plan, or you can use the Department of Health's model plan, or adapt the Environmental Protection Agency's 3Ts plan. So the EPA's 3Ts plan stands for training, testing, and taking action. The MDH version is a shorter, more customized version of the EPA 3Ts, and these can be used as a guide for making your own plan. Some of the main components that your lead in drinking water plan should include are the who, what, when, and how of your program. So who will inventory the water fixtures, collect the water samples, communicate and report the results? Essentially, who is the point person for this project? And keep in mind that this can be divided by a couple different people if you wanted to assign different tasks to different people. So including that in your plan for who will be doing what. And then also what water fixtures will be tested. As Blake just mentioned, all fixtures that are used for consumption should be tested. So anything that's used for cooking, drinking, making baby formula. And then when will you complete the water testing? As a reminder, every fixture used for consumption must be tested at least once every 5 years for lead. So if you tested all of your water fixtures last year in 2023, then you can write that in your plan and also write that you will do your next round of testing in 2028. And keep in mind, you can also test the building in smaller zones if need be due to scheduling or budget reasons. Maybe you'll plan on testing half of the building this year and the other half of the building next year. All of that would be good to include in your plan. And then how the water sampling will be completed. Do you plan on using the Minnesota Department of Health program for your testing? We'll talk more about that later. Or maybe you plan on ordering a sample kit from an accredited laboratory. Or maybe your school district already is working with an environmental health consultant and they'll be the ones that collect the water samples for you. Creating a sample plan. This goes more into the what from the last slide. So what fixtures are in your building? You'll start by doing an inventory of the water fixtures within your building. And details that will be needed for each one are a unique fixture ID. This is essentially like a code number that helps keep track of all of the water fixtures and all the water samples. With our Department of Health program, we usually have the fixture ID numbers just be like 101, 102, 103, etc. And then you'll write what type of a fixture it is. Is it a drinking fountain, a sink faucet, a water bottle filler, etc.? You'll have a description of where that fixture is located and try to be as descriptive as possible. For example, in the kitchen, maybe there's a lot of different sinks in there. So you'll say it's the sink on the south wall of the kitchen, or it's the drinking fountain in the gymnasium on the left. And so trying to be really specific, especially if there's multiple fixtures right by each other or multiple within a room. You'll list how that fixture is used. Essentially, is it used for consumption or not? And there might be some other details that you would want to include, like if that fixture is actively being used, or maybe it's currently under repair, so it's inactive. Maybe it's a fixture that you winterize. That would be important to know. So when you're making your plan for when to test the water, you would want to make sure to do that one in a warmer month when that fixture is up and running. maybe you would write if that fixture is one that is flushed before it's used, or if there's a water filter on that fixture, etc. And some facilities find it helpful to print out a map of their building, like the picture on the left here, and maybe take like a red pen and mark where all the different fixtures are located within your building. So if you have a large building or a lot of fixtures, that might be helpful to utilize the building map. However, that's optional. It's not something that you need to do. It's just something that could be helpful for those of you with larger buildings. So step 2 of the model plan is to conduct first draw tap sampling. So you will be collecting a 250 milliliter first draw water sample. That water sample size is like the sample bottles in the picture in the center there. The bottles are fairly small for 250 milliliters. It's about a handheld size bottle, and you'll be collecting the first amount of water that comes out of the fixture. And you'll start with sampling at the fixtures that are closest to where the water comes into the building. And then from that point, you'll kind of work outwards or in a clockwise pattern to collect your water samples. Things that you don't want to do not test immediately after an extended closure. This might result in an abnormally high lead result since the water has been sitting stagnant in the plumbing for a few days, weeks, or even months if it's been over the course of summer break. So you'll want to test the water during the school year when the water is being used as normal. Do not use the water 8 to 18 hours before sample collection. This is called a stagnation period, and it allows us to see what the condition of the water is like after it's been unused overnight. So you'll want to collect the first water samples first thing in the morning before people start arriving and using the water for the day. And I'd recommend don't test first thing Monday morning, just because that might give us an abnormally high lead result because the stagnation period would have been over the weekend, and that would have been over 18 hours. So I would recommend collecting your water samples maybe on like a Tuesday through Friday morning. We're trying to get an idea of what the water is like just on a typical day. And then do not flush the water before the stagnation period unless your facility has a daily flushing protocol. So when we say flushing here, we mean running the water. So don't flush or run the water in preparation for collecting your water samples. Some facilities flush the water at their fixtures every morning before using the water for consumption. However, most facilities don't do that. So if you don't flush the water every day before consumption, don't do that before collecting your water samples either. Since that's not something that you typically do on a regular basis, the results wouldn't be representative of how the fixture is typically used. And then do not remove aerators or attachments. There is no need to disassemble or detach anything before collecting your water samples. You can leave any attachments like water filters or faucet aerators on the fixture.
Thanks, Caroline. I'm Anna Schleep. I'm the lead coordinator at the Minnesota Department of Health. I help coordinate the grant program as well as coordinating efforts with public water systems across different units at the Department of Health. I'm going to talk about, there we go, interpreting your results. So now that you've sampled all of your fixtures used for consumption, you'll be getting results back from your laboratory or consultant, and you'll want to know what to do with those result information. For results that are less than 5 parts per billion, those are results where the water fixture can continue to be used as options are considered. So we know that anytime lead is detected, we want to take some action, but it doesn't always require that we stop using a fixture. So when results are between 2 parts per billion and less than 5 parts per billion, again, you can continue to use your water fixture, but you may want to consider other measures like regularly cleaning aerators or developing a flushing program or potentially using water filters, but that's not required. Sometimes you'll see on your results a symbol that looks like a less than symbol, or it may say ND or non-detect. So those mean that your fixtures did not have any lead present, and that you can use the water as normal throughout the day. And then in either of those cases, you would retest your lead, retest the water in 5 years. The more challenging results are those that are 5 parts per billion or more. In those cases, the tap may not be used for food or drinking water use or preparing formula until remediated to below 5 parts per billion. And I'll talk about some of those remediation actions here in a moment. The first thing you would do is to take that tap out of service and use a tap that is low in lead, or potentially use another source of drinking water. After you've remediated, you'll want to retest any fixture before you bring those fixtures back online. Looking at corrective actions is step number 4 in the model plan. So we know there's no safe level of lead, but there are different actions we can take because lead may be different throughout fixtures in your building. In some cases, you may find most of your fixtures are low levels or non-detect, and maybe you have one fixture that's of concern. In rare cases, we may see an entire building where lead levels are above 5 parts per billion, and they're more immediate and maybe a larger scope of corrective actions might be looked at. So some immediate steps you can take as soon as your lab results arrive. You want to respond quickly to protect public health and preserve the trust of the families that you work with. So any fixtures where that lead result was 5 parts per billion or more, you want to turn off or bag them. Think about kind of like that locking key or lockout tagout that you might do for other things. You can also post signs to indicate the way the water should be used. If it's 5 parts per billion or more, they can't use it for drinking water or consumption, but it's still okay to use for hand washing or cleaning purposes. So you might use signage to assist you in communicating. Some interim steps that you can do are continuing to keep fixtures online, but potentially using a point of use or POU device, or a pitcher filter, or a filter that attaches onto your sink. Another step that can be taken would be to clean the aerators. Many times you can just unscrew an aerator and clean it and then put it back on. That can also reduce lead in drinking water. Develop flushing procedures for your building. So Caroline previously mentioned that some buildings may do daily flushing to reduce lead. Some buildings will do daily flushing, other buildings may do twice a day flushing, or some buildings may do just flushing at an individual fixture. So flushing programs can be specific to buildings and to fixtures as well. Provide bottled water in extreme cases. As I mentioned, if you have high lead results across all of your fixtures, that might be an extreme case where you would look at bottled water until you're able to solve the problem. Some permanent ways to reduce lead that have more long-term effects would be considering how to get lead out of the plumbing. So that may be permanently removing fixtures that test high no matter what you've tried. Sometimes flushing may not be enough to reduce lead to below 5 parts per billion. Sometimes you may have fixtures that people aren't really using very often. And so the water is always stagnant at those fixtures and it's got a high water age. Those might also be fixtures that you consider permanently removing. In some cases, you do need those fixtures. Maybe they're in a higher traffic area. And so those might be ones you consider replacing, and consider replacing nearby materials if they may also be made of lead or have higher lead content. Another great thing to look at might be to talk to your water system to determine if you have a lead service line, which is the line that connects your building to the water mains. Single-family homes have a service line that's the size that could potentially be lead. Most schools do not have lead service lines. However, they may have something called a lead gooseneck connector, or if they have a smaller diameter service line, so that's the size of the pipe, they may also have a lead service line. So that's a great question to talk to your water system about if you don't have that information. Some other options that can assist with flushing may be to install solenoid flushing devices so that you can automate some of the flushing, especially in a large building where it may take a lot of staff time to flush the entire building. We mentioned using filtration devices. If you do move to using filters, you'll want to make sure that you put into your plan how often you will maintain those devices and how often you may need to replace filters within those devices. And then again, anytime you do remediation, you want to make sure that you retest and that the lead got to 5 parts per billion, was below 5 parts per billion. Some things you can do during remediation would be to look for the sources of lead within your plumbing. Blake mentioned several sources of lead earlier in the program, but if you've got lead results that are 5 parts per billion or more, this might become a step that you can do to help you really reduce lead within your building plumbing. So common sources of lead, again, are leaded solder. That's usually put into buildings prior to 1986. You can look for any old chrome-plated brass faucets, brass shutoff valves, elbows, and connectors. And then look for if you still have an old lead-lined water tanks. Many school buildings have taken these out already, but it's also worth checking to see if one of those may still be in use. We mentioned common sinks for lead, especially the faucet aerators, which are often screens at the end of faucet fixtures. Sometimes those are visible and you can simply unscrew them. Sometimes they're recessed up into the fixture and you may need to use a special tool or key to get those out. One other resource you can use are lead check swabs. They're commonly used to identify lead paint. And if you do have exposed plumbing where you can actually make contact with the metal, you can use a check swab to help look for sources like lead solder or those brass shutoff valves if you have a fixture that's giving you trouble and you can't get it to be below 5 parts per billion. You could take that step before you try and replace it. Some other remediation strategies. So starting simple, not every remediation strategy has to be an expensive plumbing replacement project. So one great strategy that can be done is that aerator cleaning. This is a really great solution to remove lead sediments that have built up over time, and it's a good general water quality measure. We recommend doing it about once every 6 months, but if you are noticing that it's getting very dirty after 6 months, maybe moving to a quarterly or monthly might be a good strategy also. This strategy does not remove the primary source of lead. It's not taking out lead plumbing. It's only taking out particulates that are coming from the plumbing. The simplest way you can do this is to take that aerator housing off. In most cases, you can unscrew it. You'll soak it in just white vinegar for about 5 minutes. Brush off any particulates that are on the aerator, rinse it with water, and then put it back together. So you'll want to make sure that you keep any pieces that are part of that aerator. Sometimes there's also a rubber gasket or a ring that also goes within that aerator. Two of the other strategies are flushing, which Caroline mentioned is letting the water run. So flushing can be done several ways. It can be done by hand once daily or before each use. This is one where sometimes people will often put signage to flush before use or let it run until it's cold. If you're going to use signage, you want to make sure that it's accessible signage to anyone who would be using it for drinking. We can't really expect a small child to understand the importance of flushing the water. So you'll want to make sure that any adults that are in the building also know that the water should be flushed. So again, it can be a low-cost option, but time intensive if you have many fixtures throughout your building that need to be flushed. And it's important to know that flushing daily might not reduce lead levels all day long. If there are periods during the day where the water's unused, lead can build up again, and it may need to be flushed more than once. Some buildings flush twice a day, for example, depending on the schedule of the building. And that's something that you can test for while you're examining if a flushing strategy will work for you. So once you determine if flushing works, maybe you take a sample in the middle of the day to see if lead has come back. And if it hasn't, then you can proceed with your once a day flushing. Or if it's started to build back up again, you may want to flush it twice a day. If you have a large building, you may want to look at automated flushing. So these are devices that can flush fixtures or water throughout the building. They also improve water quality throughout the building because they keep the water fresh more throughout the entire building. The devices can be more expensive, but they're also great if you're looking again at a whole building solution rather than one fixture. And then the last one is filtration, and there are several options: whole system, point of use or POU device, or a pitcher filter. The important thing if you use any type of filtration system is to make sure it's certified to reduce lead, and that's looking for an NSF or ANSI standard of 53 or 58 certification. They can be fairly quick to implement depending on the type of device. If you're putting a device that needs plumbing installation, that may be more expensive, or whole system units can also be more expensive. And then again, considering proper installation and the ongoing maintenance as you evaluate the different options. If you have a filter device, you're going to have to make sure that filters are replaced regularly in order to continue to reduce lead. We mentioned fixture removal and replacement. For that removal, make sure that you've really made that fixture so no one can actually drink from it. This could be capping it, disconnecting it, or physically taking out. And again, if you've got those rarely used fixtures, this is a great option to make sure that you don't continually get a high results by retesting a fixture that's always got stagnant water in it. It's also a good opportunity to look at how water is used within your building and improve entire building water quality. A lot of times buildings, like a school building, have branches where maybe water's not used quite as frequently, and fixture removal can take a branch where that water might not be used as frequently, and then the water throughout the rest of the building can also improve. And again, it may not be an option if you have widespread issues. That might be a situation where you have to look at a different strategy. Replacing fixtures, again, if you go that route, you want to look to make sure that the fixtures you're using for replacement are NSF lead-free certified. These can be very, very effective for reducing lead, especially if you had a lead service line. Replacing it can reduce lead within your building by more than 50%. Schools typically have in-house expertise available to replace individual fixtures within their buildings. But you may need to contact a plumber to make sure that you're following all of the plumbing code. And then step 5 is retesting, and I will hand it back to Caroline.
Thank you. So if you are a facility that maybe had some elevated levels of lead at some of your fixtures and needed to do some remediation, then after remediating, you would want to do a retest where you could retest those fixtures that you used remediation at to see if the level of lead has indeed been lowered. So usually when we do retesting, we'll send 2 sample bottles for each of those fixtures. One sample bottle will be for first draw water sample. So that'll be just like the first time you did the sampling where you collect that first amount of water that comes out of the fixture after the stagnation period. But this time, instead of turning off the water after you fill up the bottle, you'll leave it running. And once that water has run for at least 30 seconds or so, you'll use a second bottle to collect a second sample so we can see what the water is like after it's been flushed for at least 30 seconds. So you'll take 2 samples for each fixture that you want to retest. We'll send those to the lab where they'll be analyzed. And then once the results come in, we can take a look and see if for each of those fixtures, the level of lead has been lowered to under 5 parts per billion. If the answer is yes, then great. We can, just keep doing that remediation action to make sure that the level of lead stays under 5 parts per billion. If we look at the results and see that, we're still seeing some elevated levels maybe at some of the fixtures, then you would want to keep trying out some different remediation strategies and retesting until that level of lead has been lowered to under 5 parts per billion. I'll hand it back over to Anna.
Thanks, Caroline. Oh. So that takes us to step 6, which is communicating results. Schools and childcares have different requirements for communicating results. So I'm going to start with this requirements for school, and then I'll remind you to check the model plan because that has the most details on the statute requirements. So the first thing that we'll need to be communicated is posting the testing plan, results, and any remediation information on the school's website. And this website information must be updated annually. So it might be that you don't actually have updates to post annually. Some facilities are testing and have new results to post. You may not have new results or new information to post annually. You can just leave that same information up if that's the case. You just want to make sure that any information you have up is the most accurate, and you only need to do that update once a year. You must send parents an annual notice that includes how to access the annual testing and remediation plan, information on how to find test results, and a description of remediation efforts on the school website. So that annual notice can be as simple as information directing them to your website where they can get to the required information. Then in an official handbook or a policy guide, like if you have a student handbook or a school policy guide that includes other health and safety information, you want to include that same information on how parents can find test results, and again, a description of remediation efforts, and on the website, and how often this information is updated. So if you're referring back to your website, then you can let them know that where that website is and that it's updated annually. Then if you have results that are at or above 5 parts per billion, you'll want to be within 30 days of getting your results back. You want to either remediate or retest to see if it's below 5, or if you're not able to do those, then you need to directly notify parents of the high drinking water results. And that just gives parents the opportunity to take any actions on their own that they may want to do. You must also report results and remediation actions to MDH beginning July 1st and then annually going forward. So most schools have been testing since 2017 or 2018, and there have been some schools testing following the guidance that went back to the 80s. Blake's going to go over what actually needs to be reported to MDH beginning this year. But it won't have to be all of your actions going back to the very start of your program. So he'll go over that in more detail. And then for childcare centers. So as a reminder, the statute applies to childcare centers. It does not apply to family childcares, although we do recommend that family childcares test for lead and communicate their results. So childcare centers are required to make any test results and remediation actions available to parents and staff and notify them of the availability to access those results. So that reporting must occur within 30 days of getting results back and then annually thereafter. So again, if you're testing once every 5 years, it might just be notifying them of results that you took last year. If you think about as you get new children in your program, they may not have realized you tested a previous year unless you give them that information. It's not requiring you to test annually. You can still test once every 5 years. And then beginning July 1st, 2024, childcare centers must also provide results and remediation actions to MDH on or before July 1st every year. So this doesn't mean you have to test every year. It just means you have to let us know if you have taken any new test results or any new remediation actions. Some information on how those communications might occur. You could post on your website, which is a requirement for schools, but it's one option a childcare could consider. Mail or email results or information about how to obtain results. Another common one, especially in more of a childcare center test setting, might be to post in an office in a common area like a bulletin board, distributed to staff or shared during parent meetings or school board meetings so that those results are then part of the minute notes. And now on to step 7. So I'll hand it back to Blake, who will talk about reporting results.
Thanks, Anna. So step 7 is reporting your results to MDH, and there are 2 categories of facilities that need to report their results: public and charter schools and child care centers. So reporting your results is a 3-step process. First, you'll download the results and remediation reporting spreadsheet, and the link to that is displayed under the cloud icon on the left. Then after downloading it, you'll fill out the required fields. And then finally, you'll submit your results to us by attaching the spreadsheet to an email and sending it to our lead results reporting inbox. And that email address is displayed below on the right. After we receive the spreadsheets, we'll review them and we'll reach out if we have any questions. The goal of the reporting is to create an online dashboard where members of the public can search facilities to view their results. This dashboard is anticipated to be available by December of 2024. Use the link to the spreadsheet. There are a few easy steps to find it online. So first, you'll search something similar to drinking water in schools, child cares, and Head Start programs, MDH, and look for our website, which should be a top result. The link to that website is also displayed below the screenshot on the left. Then scroll through the web page and select View Model Plan. This will take you to the Model Plan web page, which has a layout similar to the presentation. Scroll to step 7, and under that tab, you'll find both the reporting spreadsheet as well as the results reporting instructions and FAQ document, which can answer a lot of common questions you might have. Now I'm going to go through the reporting spreadsheet itself with some example data. So this is the facility information tab where you'll enter data relating to your facility. To start off with, you'll enter the name of the facility or building and whether or not you tested using our MDH WIN program, which we're going to discuss a little bit more later in the presentation. Then you'll let us know if you're a school or a childcare, and depending on that, either your school ID number or your childcare license number. So childcare centers, please use your DHS license number, and for schools, please use your Minnesota Department of Education ID number. If your school does not have one of those numbers, you can leave that field blank and still submit your spreadsheet. If you're a district where you have multiple schools in one building, please list all the numbers associated with that building in the spreadsheet. And then just a reminder, please fill out that section with the full 9-digit ID number if you have one. Then you can enter your facility or building address, and if you have a different mailing address, you can enter that as well. Then you'll select your contact person, and this is who we will reach out to if we have any questions about your submission. So you can enter their title if you want, and then make sure to enter at least one of their phone or email, but we would prefer both if possible. Then, if applicable, you can enter your lead-related website. So as we've said, this is required for schools, but it's optional for childcare centers. And then finally, you can leave the last field blank, and we will fill that out when we receive your spreadsheet. Now we're going to move on to the results and remediation tab, and this is where you'll enter your result data. So this is the second tab of the reporting spreadsheet, and the third and final tab is a definitions tab, which includes some key definitions and terms. I'm not going to go through that today, but it can be helpful to review when you're entering your data, and it might answer some questions you could have. One other note before we go through the spreadsheet is when deciding what lab you want to analyze your samples, it's important to ask what format they can give you your results in. They can give them to you in a spreadsheet instead of a PDF. That can make data entry go a lot faster for you, but each lab is different, so you'll want to make sure to ask. So I have some example data listed here, and I'm going to go through it to give you a sense of a couple different scenarios that might come up when you're entering your data. So the first field is the unique sample ID, and this is the unique code you created for each fixture in your facility when you first made your sample plan. Then you'll enter your fixture type, and that's just what the fixture is. So it might be a sink or a fountain or a bottle filler. And then the next column is a specific description of the fixture's location. For example, classroom sink in room 112. And this is helpful for the public because once the dashboard is live, they won't really have a sense of where or what S101 is, but they'll be able to understand what you mean when you say classroom sink 101. And then the next field is fixture status, and this is a combination of either active or inactive and consumption or non-consumption. So active is a fixture that is currently able to be used, and inactive is a fixture that has been taken out of service either temporarily or permanently. Consumption is when a fixture is used for drinking water or food and formula preparation, and non-consumption is when you use the water for some other purpose. MDH recommends that non-consumption fixtures that are not tested be labeled as not for drinking to ensure that there is no confusion. So looking at our examples here, you can see that most of our fixtures are active in consumption, which makes sense when you see that they're drinking fountains or bottle fillers, maybe a faucet. But our top example there is active non-consumption, and you can see the description is a mop sink. So something you might use for custodial things, but you're not cooking with that water and no one's drinking it. The next column is the sample collection type, and this is another combination field of either initial or follow-up and first draw or flushed. So initial is when a sample is collected when you're doing your first round of monitoring, and follow-up is when you collected that sample because you're retesting due to the initial result being 5 parts per billion or more. And then first draw is a water sample that has been stagnant for 8 to 18 hours before sampling, like Caroline was describing. And then flushed is when you let the water run just a little bit before you collect that sample. So looking at our examples, our first 5 were all initial first draw samples taken during our first round of monitoring. But let's say our initial sample of 303-BF came back as above 5 parts per billion. In that case, we would take 2 follow-up samples after conducting our remediation, one as a first draw and one as a flush sample, and you can see those as the bottom 2 rows on your screen. We'll see later that S206 also came back as above 5 parts per billion, but for this example, we're going to imagine that you haven't yet been able to conduct follow-up sampling at that fixture. So the next column is the laboratory ID number, and this is an optional field. It's the number a lab will assign each unique sample they analyze. Keep track of many samples across a lot of events. But again, it's optional, so you don't have to fill it out. This is also a good time to point out that when you're filling out the spreadsheet, columns in white are generally data that you, the facility, will already have. So you already know your fixture codes, you know where they are, and you know what kind of samples you collected. But columns in green are generally data that you'll get from the lab report. So the lab report will tell you the ID number, and it'll also tell you the date and time they analyzed the sample. And you'll already know the date and time you collected it, but it'll repeat that on the lab report as well. This slide shows the rest of the fields on our results and remediation tab. So the next one is the result column, and this is the result that the lab reported. If your result came back as non-detect, please enter ND. Then the next column is the units of measure, and this is again reported by the lab, and it's usually micrograms per liter or UG/L. So one note here is that this is equivalent to parts per billion. So when we say that 5 parts per billion is our threshold, so is 5 UG/L. Then you'll enter the name of the lab that conducted the analysis, and then column L is our remediation action column. And you only use this if the related fixture result is 5 parts per billion or more. So in this example, our first 3 samples didn't require remediation, so they're blank. Our 4th initial sample required remediation, so we opened the drop-down menu and we selected our planned action, which in this case is aerator cleaning. In this scenario, we haven't yet been able to conduct follow-up testing, but we know we'll have to because the result was over 5 ppb. Our 5th initial sample also required remediation, so we selected flushing, and we also applied this to the 2 related follow-up samples below it. We have a lot of different options listed in this drop-down menu, but if your planned action is not listed, you can select other and then enter it in the M column. So then we'll skip to the N column, which is, was my remediation successful? So there are 4 options in this drop-down menu: yes, no, pending, and not applicable. So for our first 3 samples, they were initially below 5 parts per billion. So we didn't do any remediation and we entered not applicable. For our 4th sample, we haven't yet been able to conduct follow-up testing, so we selected our planned remediation action, but we put pending for whether or not it was successful since we haven't sampled it again. And for our last 3 samples, the remediation action of flushing successfully lowered the lead level to below 5 parts per billion. And we can see that because the last result in the bottom row is non-detect, which was our follow-up flushed sample. But we can imagine a scenario where the flushing didn't work and that bottom result was, for example, 6 parts per billion. So in that case, you would enter no in the N column for those 3 related samples since you weren't able to get it to below 5 ppb. And then the last column here is the additional notes or comments section, and that is anything, any additional information you'd like to include about the sample. So now we're going to jump back to the facility information tab where we have a separate summary section to fill out. So first you'll enter the total number of samples. In our example, we collected 7 samples. And then you'll enter the total number of unique fixtures that you sampled. So in our example, we sampled at 5 fixtures. We just had a couple of samples at 1 fixture. Then you'll enter the total number of results above 5 parts per billion, and then the total number of remediation actions or fixtures that were remediated. In our example, we had 2 remediation actions. And we didn't show it, but this would also include any fixtures that you remove from service. So finally, you'll enter your next scheduled sampling date. So facilities need to sample all fixtures used for consumption at least once every 5 years. In our example, we only had 5 fixtures, so we'll sample them all again in 5 years, and we put February 2029. But some locations might split up their sampling, for example, sample a fifth of their fixtures every year for 5 years. And that's just fine as long as all fixtures used for consumption are sampled at least once in those 5 years. In that case, your next scheduled sampling date might be February of 2025. So now that you've entered your results, you can attach them to an email and send them to our lead results reporting inbox. And if we have any questions, our staff will reach out to your listed contact person. If after reviewing the definitions tab in the spreadsheet and the instructions/FAQ document, you still have unanswered questions, please direct them to that same lead results email. So now I'm going to go through some common questions, one of which is, which samples do I need to report? So only samples collected on August 1st, 2023 and onward are required to be reported. If your facility has tested in the last 5 years, you are not required to sample again solely for reporting purposes. You do not need to change your 5-year testing schedule. Facilities that will sample in a future year will need to complete just the facility information tab so we know when you're sampling again, or provide their most recent sampling results if you want something displayed in the online dashboard. So for example, let's say you're a facility that tested in May of 2021 and you sampled all your fixtures. In that case, you do not need to test again until May of 2026, but you have to either complete the facility info tab and let us know when you're testing again, or report your 2021 results if you want something displayed in the dashboard. So the key takeaway here is that all facilities need to report something. Another common question we get is, do I need to report my samples if they were all non-detect? Or do I need to report all samples or just those over 5 parts per billion? And the answer to both these questions is that all samples taken on or after August 1st, 2023 need to be reported regardless of the numeric result. So in my example, I had a few samples that were non-detect, a few over 5, and a few in between. But they were all taken in February of 2024, so I had to report all of them. We've also been asked how to report follow-up samples. So the process for reporting follow-up samples is the same as reporting initial samples. Individual sample results should be completed as an individual line item. And if you have any additional information you want to include, you can put that in the additional notes and comments field. So in my example, I had a couple follow-up samples and I included them in the same spreadsheet as the initial samples and reported them all at once. We've also been asked a scenario in that if you're a school that you're located within a building and the entire building is tested at one time, should school and non-school samples be split up? So only the results from the school are required to be submitted. But all results submitted by a facility will be published on the dashboard for the facility that submitted them. So you should be prepared to answer any questions that you receive about any of the results that you submit. And finally, for WIN participants, we will submit your results, but we need your remediation information. So for those in the WIN program, we receive your results from the lab before we send them to you. If some of your fixtures require remediation, we'll send you the spreadsheet with the results and ask for that info, which you'll then need to provide. But after you provide that, we will enter the rest of the data for you. If your results didn't require any remediation, we'll still reach out and ask if you have any additional things that you would like to include, such as previous test results. And then you can let us know either way, and we will submit the rest of the data for you afterward. So now that we've finished step 7, I'm going to hand it back to Anna to learn about water management plans.
Thanks, Blake. Step 8 of the model plan is water management plan. So this applies to schools as a requirement, but is a great thing to think about for any type of facility. A water management plan is a tool to maintain and improve facility water quality. Water management plans can be included within your lead testing plan, or you may choose to write them as a separate document. So the main things that a water management plan will address are identifying all fixtures and identify how they are used, which you may have already done as part of your lead testing plan. Identify areas of concern within the building plumbing. So these may be areas where you expect that the water quality has low water usage, or that have had previous complaints about water quality, or maybe there are other challenges like a leaking fixture. So these might be areas where you want to give some additional attention to. Decide what routine maintenance strategies should be used and how to assess their effectiveness. So many facilities have their own routine maintenance strategies, whether that's flushing, aerator cleaning, or some other programs that they may have. But we want to also consider how to assess that we're being effective and following those strategies regularly. Decide how you will intervene based on water quality concerns. So if you do have a complaint about water quality, what will be your plan for investigating and responding to that water quality concern? That complaint or concern could come from a parent, a staff member, or a student, and you'll want to have a plan for how you'll respond to that, and that can help you be prepared to address those concerns. And then making sure your program is running as designed and is remaining effective. So, after a year of doing your water management plan, regularly going back and seeing if there's ways to improve your plan, or if maybe there's something that's not effective that you could change. Then document and share results. So for a school, the water management plan is also one of those things that you'll want to keep on your website with your lead testing plan and your testing results. And that's all I've got for the water management plan. I'm going to pass it back to Caroline, who's going to talk about the WIN program.
Thank you. So how the Minnesota Department of Health can help with your lead and drinking water testing. One way is through our WIN program, which stands for Water Infrastructure Improvements for the Nation. Much easier just to say WIN. This is a program that allows us to provide free lead and drinking water test kits to public schools, charter schools, licensed childcare providers, and Head Start programs in the state. And we're able to do this by utilizing a federal grant that we receive. And participants in the program have the flexibility if they want to test or collect their own water samples, or if they find that they could use some help with that. We also work with a contractor called Bay West, and we can connect them and have Bay West send someone out to the facility to collect your water samples for you. Lab analysis of the water samples is also included in the program, and that's done at the Public Health Lab located in St. Paul. And then once the results, we get the results back, we provide assistance with looking through those, seeing if there were any samples that did have an elevated level of lead, and talking through the different remediation options that you could try out if need be. And then also throughout this whole process, we're offering training on best water management practices, things like using cold water for consumption or flushing the water if it hasn't been used in a while. Facilities don't have to use the Minnesota Department of Health WIN program for doing their lead and drinking water testing. However, there is the kind of cost benefit in that we are able to provide those test kits and the lab analysis free of cost. And then how the program works. So it starts by a facility filling out an online application form. It's just a few questions, essentially expressing your interest in the program. And then we will reach out to you to find a time to meet virtually and go over kind of how everything works, We talk about how to use 120 Water, which is the website we use for keeping track of all the water samples. We also talk about how to collect the water samples. Usually that first orientation training session takes about 45 to 60 minutes or so. And then each facility will develop a sample plan for where they want to test the water in their building. Once that plan is created, we'll send you a sample kit in the mail. So essentially that's that box with empty water bottles in it. And then you can collect your water samples and send them back to us at the lab. We include a shipping label as well, so you don't need to pay for shipping either for returning those water samples. And then it usually takes the lab at least 4 weeks or so to get results. And once we have those, we will email them to you. And at that point, we'll also, like I mentioned, look through to see if any did have elevated levels of lead, talk about remediation options. And at that point, if need be, a facility would remediate and possibly do some retesting, in which case it would kind of go up to here again, where we would send some more sample bottles and help with the retesting process as well. And then also the last step of the process is sharing the results with the public, as Anna mentioned, as required for schools and childcare centers, making those available and letting people know how they can view the results if they're interested. And we do have pre-written communication templates you can use as well. So as you're sending out notifications to families, letting them know that you've completed your required lead and drinking water testing, you can feel free to use our pre-written version and plug in the information specific to your facility. Of course, you can write your own messaging as well if you'd like, but keep in mind that we have those available to utilize if you'd like. I did want to mention that this whole process can take some time to complete. It sometimes might take a few weeks for, reviewing the sample plans and getting the sample kits sent out, just due to the high demand we've seen over the summer, especially with the new requirement for childcare centers going into effect on July 1st of 2024. So just wanted to make facilities aware of that, just so you can keep that in mind as far as your timeline for things. And another way that the Department of Health can help is through 2 different grants that we have. One of them is a remediation grant, which was part of the legislative updates from last year, and it included funding for a grant specifically for schools and childcare centers with elevated levels of lead in their drinking water, who are seeking assistance with doing some of those remediation projects, whether that be removing or replacing fixtures, if any plumbing needs to be replaced, installing flushing devices, etc. And we have this grant for 4 years. So we have already done the first round of applications and funding, and then we'll have it at least for the next 3 years as well. Hopefully after that, we'll be able to continue to receive funding to keep this grant going. But for the next 3 years, we'll have $239,000 per year to award to facilities. And we estimate we'll be able to provide funding to between 6 and 15 facilities each year for projects. And the estimated amount awarded per facility is $8,000 to $15,000. And we anticipate that the next time the remediation grant application period will be open will be this upcoming fall, so fall of 2024, for that next round of funding. And we have the link there at the bottom if you'd like to learn more about that remediation grant. And then the other grant is a hydration station grant. So we have a picture of a hydration station in the center here. And this is a grant that we partner with the Oral Health Program at the Department of Health to provide these hydration stations. And it's kind of a win-win for both their program and ours. These are nice for the Oral Health Program because it encourages drinking water versus sugary beverages. But also on our side of things with our program, we like them because these are filtered water stations, so they also help minimize lead and drinking water risk at facilities. These hydration stations for the grant locations that have dental health professional shortage areas are often prioritized, as well as locations with elevated levels of lead in drinking water. And it's nice too with these hydration stations because they also promote oral health education about water and safe fluoridation. Last year, we provided 6 hydration stations to facilities, and this year it's estimated, or we're anticipating that grant application period will be open again, also kind of like late fall, early winter. And we have the link for learning more about the hydration station grant listed on the bottom right there. And then finally, we have our contact information. At the top there, we have our program email address. So that goes to me, Anna, and Blake if you have any questions that come up along the way. We also have our phone number if you'd like to give us a call. And then if you're not already a subscriber to our lead testing and drinking water email list, we would recommend that you do that if you're interested. You can click that link there in the center to subscribe to that list. We don't send out emails too often, so you won't be getting your inbox flooded by us. But just when big things are happening that we want to make sure people know about, for example, when those grant application periods open, we'll send out notifications to our email list about that. So it's a good one to be a part of if you're not already. And then at the bottom, we have the QR code, which goes to our WIN program webpage. So if you scan that with your phone camera, it'll bring you to our webpage. And if you would like to utilize that WIN program for testing the drinking water at your facility for lead, you can go to that webpage and you'll see a link for that online application form to fill out. So that's the first step, is just filling out that form and submitting that to us so we know that you're interested. And then we will reach out and set things up with you from there. So yes, please feel free to get a hold of us if any questions come up along the way. We are here to help, and that brings us to the end. So I would just like to thank everyone so much for watching this webinar today, and we hope you have a great rest of your day.